Hello, everyone. Welcome back to my channel. Today I've got a guest, my childhood friend, a doctor, beauty with brains. Hi, Nancy.
Hey, Anna.
Good to have you. She's such a wise woman. So you guys are going to be learning a lot from her today. So I'm super excited about this because we've been trying to do it for a while. And we are glad that it's finally happening. So I'll allow her to introduce herself a bit and just share a little about who she is so that you guys can get an idea of who's Mercy, because you're probably saying, okay, what is she on about? So, hi, Mercy. Tell us a little
Hey,
about
Anna,
yourself.
thank you for having me on your channel. And it's quite a privilege, actually, to be able to talk about something that I'm really passionate about. So I'm Mercy. I am, first of all, I guess, a Christian, a child of God, number one.
Yeah.
And I am a daughter, a sister, a wife, and a mother as well. I'm a doctor. I'm currently based in Namibia. So I practice, I'm in private practice at a psychiatry practice and basically just deal with mental health issues. Apparently our practice is actually the biggest practice in the country, I think, although of course, because the country is very small, but we, I think, service a large proportion of the people here and meet their mental health needs. Yeah.
So guys, we're going to be learning a lot from Mercy today. So I'm super excited. So we're going to just be real. That's the point of candid conversation. Growing up, you know, in our African culture, we were told when you go to people's houses, you know, before you enter the house, be careful of what you're going to say. There are certain conversations where when you'd get comfortable, your parents are looking at you and saying, hey, when we leave this house, you are in trouble. And what's ironic is now we are telling people to open up. We're saying if you are going through any struggles, open up, and people are struggling with that. So that's what we want to talk about when it comes to mental health issues. Where do we start? What are the statistics maybe of how many people commit suicide or people being affected with mental health issues?
Okay, so I think it's people are now realizing that you can't ignore a problem and expect it to go away. I think that's and the reality that mental illness is a part of us, just like physical illness is. So people have always shunned it or stigmatized it because of ignorance. People always come from a place of ignorance. But when you ignore something, it doesn't go away. It just makes the problem bigger, you know? And so you'll find that people are really struggling. So when it comes to mental health in Namibia, anyway, where I am, and I think in Zimbabwe, it's very similar, and even throughout the world, there are certain things that you realize that people will say, no, you know, mental illness is for the Europeans or the Western world. Those are the ones who struggle with their mental health. In Africa, we've got bigger problems like hunger and you know, all that stuff. And yet, if you look at it, the prevalence of mental illness is the same all over the world, you know, and especially now that we are in this crisis, this COVID pandemic, this crisis, we are actually, the numbers have gone up, like significantly, staggeringly so, and we're actually kind of anticipating that it's only going to get worse over time. So you'll find that, for instance, 1 in 4 it used to be 1 in 10, but it's now 4 in 10 people who are struggling with mental health issues, you know, concerning especially anxiety and depression. Those are the commonest illnesses around. And they just published, I think in Namibia, between January 20 2020 and June 2021, 750 people took their lives, committed suicide. Yeah, so that is a staggering number. Yeah. And if you find of those, the majority who actually had completed suicides were men, rather than women. You know, and part of it has to do with what you're talking about in terms of, especially men, you don't talk about your problems, you know, you need to just, you know, be strong and face them and whatever. And yet you realize that because of that, many people are suffering in silence and struggling because they don't know that they need to get help. They don't know that they can get help, and some of them think that it's okay or it's normal to be feeling the way that they're feeling, or they're afraid of what people will say. There's the cultural implications of being mentally ill. Then even there's the religious implications. As Christians, it's also something that we never talk about, you know. Mental illness, it's associated, some associated with demon possession, other people associated with the lack of faith, you know, different things like that. So all those things become barriers for people who actually need to get services and help for mental.
I like something you said. Can you enlighten us on the spiritual part? You said some think it's demons, because I know some people have personalities where they start seeing things and they're like, someone wants to kill me, you know. Can you explain to us why you then need to get the help and you can't just pray it away? Because some will be like, in the name of Jesus, they me with a Bible. I've seen people who literally have a Bible on top of them to say it needs to get out, you know. So how can we actually improve on that and actually educate ourselves?
Okay, so when you look at the role of religion and spirituality and mental illness, it's actually very complicated. And I really hope that I'll be able to explain myself so that people understand. There are links. I mean, there are studies that have been done that relate to, for instance, how certain religions are protective against certain mental illnesses and all that. But just like physical illnesses, you know, there are certain risk factors that increase illnesses and certain ones that reduce it. We need to also be aware of that in mental illness, but also realize that just as physical illnesses don't discriminate, mental illnesses will not discriminate and say, okay, these ones are Christians, so we don't come, you know. Exactly. And the way we relate, if we were to relate to mental illness the way we relate to physical illness, I think it would really help us in a big way. Because when somebody has a broken arm, as Christians, we pray about it, yes, but we also go to the hospital, and if that person needs that arm to be operated on, they receive an operation. And yet you'll find that when someone has a mental illness, then you're told, no, you just need to pray, and then that's it, and you can't seek help for it. So you'll find that mental illness has a wide range of symptoms, and some of them include, so maybe let me start by saying mental illness is a disease of the mind, and the mind is controls how you think, how you behave, and how you feel. So when you have a mental illness, we're basically affecting the way you think, the way you feel, and the way you behave. Okay. And so just like any other organ in the brain, if it's your lungs, for instance, are responsible for breathing, when you have a lung disease, it means you may struggle to breathe, or you cough, or you whatever it is. So whatever is wrong in whatever organ will manifest in the different symptoms. So your brain, for instance, processes what you see, what you hear, all that stuff. If something goes wrong in there, you may start to see things that other people don't see, or hear things that other people don't hear. And so the rest of us who are not experiencing that will look at you and think you're crazy, you know? And exactly, you know, and we'll say things like that. And yet somebody is experiencing hallucinations and is responding to their reality or what they're perceiving. So, of course, they may then lose touch with reality and believe things that are not real, because something has gone wrong in the way their brain is processing things. And so those things need to be addressed and treated. So you will find that, yes, there's demon possession and all those other things on that side, I won't dispute. But a lot of the times, these symptoms are actually respond very well to treatment. So I remember my mentor, Dr. Niwatiwa, she was an amazing woman. And she held up the Department of Psychiatry for so long. And I remember she would always say, demons don't respond to antipsychotics. So if you give medication to a demon possessed person, they shouldn't get better. And yet you'll find lots of people, when they come and they're hallucinating, they take medication, they get better, they go on to live their lives as normal. So a lot of people continue to struggle and don't get the help they need because they don't know that what they're struggling with is actually treatable. So the majority of mental illnesses are very treatable. Of course, just like in physical illness, you have certain severe conditions, some that will take treatment for years, for some you need to be on medication for life. Some of them don't get better, like cancer. Some cancers will kill, but some of them, if you catch them early, you can actually recover and go on to live a normal life. It's the very same thing with mental illness. If you go there and get the help that you need, your healthcare provider can determine, whether this is a treatable condition, what kind of treatment is needed, and give that treatment that is needed. And so many people can actually go on to live their lives without any challenges after an episode or something like that.
Thank you for that. That is so enlightening. And I want to ask you something, because you said it's more of the men who are committing suicide right now. What are the reasons?
So partly, I think it's because of when you look at now in the pandemic, for instance, a lot of people have lost their livelihoods. So there are, of course, different factors that contribute. One of them is what we talked about in terms of just the way we've been socialized. Women generally have better support systems, or, are able to talk through things and whatnot. Another big thing is that generally women don't have as serious attempts as men. So women attempt more. So the numbers in terms of suicide attempts are higher in women, but completed suicides are higher in men. Because when a man, for instance, decides to take his life, he's going to take a gun and shoot himself or whatever, whereas a woman will overdose on tablets and then they can quickly be rushed and they pump out on, things like that. So they are not as radical in terms of what they do. So that's one thing, but also certain predisposing factors. A lot of men who then end up committing suicide are also struggling with things like alcoholism, which is higher in men than women. And I think a large majority of people who actually then attempt suicide do it under the influence of alcohol. And I've actually had patients who come and say, no, I was very drunk, that's why I attempted. Had I not been, I wouldn't have tried it, So those are some of the factors that contribute. And also admitting to having a mental illness is seen as a sign of weakness. And so men are more vulnerable to not wanting to be seen as weak than women, I think. So because we are already considered as the weaker sex, you can kind of, and people understand when a woman cries, but not so much when a man cries. Exactly. Yeah, but when you then really think about it, why shouldn't a man cry? Like, why not? Do we not go through the same kind of emotional challenges? Do we not get hurt the same? All those things. So the way we are brought up now, it's changing, but definitely, if you look at even our culture, so it's not just the men, of course, even with the women, as much as we understand that women cry, a lot of the times we don't tolerate crying,
Yeah.
as much, and we try and suppress the negative emotions and not feel them. So, it's like when we are comforting each other, when somebody is in pain or has lost someone, most of the time, like in our Shona culture, "Toti chinyarara," like that's the
Yeah.
comfort. We're saying don't cry.
Yes.
And yet you should be able to cry. Like,
Allow
why should
yourself.
you not cry when you're going through a difficult
Wow.
time?
Yeah.
So that's part of it. It affects women, yes, but especially men. They just have to keep it in and be strong and, be the leader or whatever it is. So that burden is very high on men, I
Mm.
think. But women also struggle with it. And especially now in this day and age where you find women are heads of their homes, you've got lots of
Mhm.
women who are running, who are single parenting, things like that, or who
Yeah.
are the breadwinners and, who are
Mhm.
carrying the financial burden, all that stuff as well. So in terms of the emotional struggles, I think the struggles are there in both of them. Those numbers, like I said, will be affected by the fact that the means that women use to cope versus men, or when they then want to give up, what is it that they will try and do? Yeah.
Mm. Thank you for that. And let me know if you actually have a solution to this. So I work with married couples, and for most people, when their husband starts going through mental health issues, it affects their intimacy and even the relationships with the children. How
Yeah.
can you actually talk to your husband about getting help? Is it something that you can do as a wife, or it's actually leaving the issue to say he can figure it himself? I was saying, like you shared, that a lot of us grew up in a space where you're told, keep quiet, you don't
Yeah.
cry, men don't cry. And that means a lot of people have childhood trauma, right?
Yeah.
And how do we actually break that cycle? Because I'm with a man who was told, don't cry, or I'm with a woman who was told, don't cry, and you actually see that this person needs help. It's affecting our relationship. There's no intimacy. Person can't hang out with the children, because I'm sure you also would agree that mental health issues affect literally everything in your life without even acknowledging it. Your
Yeah.
productivity, work, home, everything, the drinking and getting ended up with addictions, like even
Yeah.
porn, that's what's
Yeah.
showing that this is why some people end up in porn. So how can we actually bring change? Maybe you can help us with that.
Okay. So I think first of all, this that we're doing right now, raising awareness, is the first
Mm-hmm.
step. So a lot of people don't actually know that they're struggling with their mental health.
Okay.
Especially men, a lot of them will come and say, I've lived with this for years. Or someone who will say,
Mm-hmm.
I've been anxious my whole life, and thought that it's normal. Or somebody always tired, always, it's a struggle to do anything, get up, go to work. Everything is just and then you don't sleep at night, you're struggling with sleep at night, you've lost interest, you don't enjoy anything anymore. Some people think it's normal to be going, to be experiencing those things. So number one is getting the information. So I think part of it is to educate ourselves on what mental illness is. Just the way now, because we know that COVID affects everyone, everybody's educated about, what are the symptoms of COVID, and, how long does it take before you get sick, or
Yes.
we have lots of information because it affects us. And so it should be the same with mental illness and mental health issues, that if we educate ourselves and become more aware of the risks that we are all at when it comes to mental health issues, then we are able to then address the things. So the way that I have dealt, because a lot of the times you will find that couples do struggle with their mental health, and because there's genetic vulnerability, trauma, childhood trauma, like you said, that has been experienced in the past, we feel like we should be able to handle it, you know, on our own, and not realize that we can't help but be affected by what has happened to us and what our experiences are and what genes we carry. We can't help but be affected by all those things. So when we realize that, and then realize that this is an illness which is not necessarily showing a defect in our character or in our strength or in our spirituality, but is only reflecting the result of genetics and, situations that we've experienced, the losses, the trauma, all that stuff, then we are able to acknowledge that we need help outside of what we're doing for ourselves. Then we can go and seek the help. So sometimes as a wife or as a husband who sees your partner struggling, being able to just give them information so that they get to a point of realizing that this is an illness. This struggle is an illness. It's not, something where I just need to work at it on my own. Because a lot of the times when people do that, it's very self-defeating. And we also come from a position where when you don't understand someone else's struggle, you just want to say, think positively and everything will be fine. And, but it's not that easy. Exactly. It's not that easy. If it were, then, we would all be able to think positively and solve everything. So being able to realize that you've got a problem and then seeking help for the problem. Some people are very resistant, obviously, but there are different ways of, trying to do it. But one of them is for you to understand that it's an illness, and then you can kind of move from there. And when you know it's an illness, then you seek help for it. People also tend to want to be gurus, for instance, in mental health, and want to solve it on their own. So it's people will quickly go and, go to the doctor if their physical health is not okay, and then get tested or whatever it is. And it's the same with mental illness. You can't just by looking at it be able to know that, okay, this is, something that we can handle or not. But if you were to compare it with the way we do it with physical illness, it really helps. So if you have a headache, for instance, or you have a cough, initially you will try your home remedies and all that stuff. But when you get to a point that this cough is a bit different, or this pain is different from, or now it's associated with a fever and what, I need to go and get help. So it's the same with mental illness as well. We all go through stresses, and sometimes you go through things that, that can shake you a bit. But when it becomes prolonged, or when the symptoms are severe, then you know that it's not just the normal, So for instance, grieving and depression can seem very similar, right? And we all go through grief. But sometimes there are certain things that then make this one worse. And people, for instance, who have health-seeking behaviors, generally, who quickly go to the doctor for whatever, go and get treatment. Sometimes you then go and be told, no, it's okay, don't worry about it. It's normal, it will get better with time. Or this condition is self-limiting, or this, it should be the same with our mental health, where we can go and say, I've not been okay. Then you can work it out and say, okay, no, this is just a response to this stressful situation. But once that is better, you will get better. Or no, this is actually something else that needs different types of intervention. Exactly. Yeah.
Yeah, there's something that you said, and I guess based on the season that we're in now, where a lot of people are losing their family members or their friends due to COVID, and not getting to be there, or that exposure, like we talked about, crying or even attending a funeral. That is
Yes.
trauma, right? Yeah.
Yes.
So I
Yeah.
would probably want you to end by sharing with us to say, how can you deal with that? Because most times we're used to getting that closure of being at a funeral or having a conversation with that person. For some people, they haven't even talked to those family members for a while.
Yeah.
And you just hear,
Yeah.
Ningi's gone.
Gone.
They're
Yeah.
gone. So how can we grieve? Because the other thing about mental health I've noticed is people are not willing to spend money on their health. You know, to say
Yeah.
a psychiatrist is $100, aha, I can do a whole lot. So someone will be like,
Yeah.
no, I'm done. But they actually don't realize what that does to them. Like stress, like you were saying, there are small
Yeah.
things you ignore. I'm having a headache for a week, yet your body is telling you you need to take a break.
Break.
You know,
Yeah.
so maybe can you help us to know the best way of maybe grieving based on what we're going through right now, or how to end an addiction? Maybe that'll be two questions then.
Okay, so I think dealing with grief is a whole topic on its own. I
Okay,
think
so
if
maybe
you
we
want,
can do that.
we can do a topic. Anna.
Sorry about that.
No, it's fine. But I think it's an important topic to go through actually, because sometimes we struggle and don't know whether this is normal or this is not normal. And like I said, part of it, you will have the extremes of those who will, go into the depths of distress and bereavement and into this deep dark hole and can't come out. And then you have the others, on the other hand, who don't want to feel anything, don't want to, and so there's a need to allow the process of grief, and it's also an individual thing. So you can't prescribe and say, no, you should grieve this way, or this one should, somebody else needs more closure than, another person, or different things like that. But we have to allow ourselves to go through the process of grieving. And so it's normal to not be okay when you're grieving, to be sad and crying and want to stay in bed all day and not do anything. That is normal. But at the same time, 1 year down the line, you can't still be in bed all day, not doing anything,
Yeah.
You need to be able to move on from that stage. So there are different stages in grief. And so you need to be able to yes, you always love and miss this person, but the nature, it's not as distressing and overwhelming as it was initially. So if you find that you are still not functioning, even sometime down the line, then that is probably complicated grief that will need more intervention. So as much as we are grieving, for instance, you'll find that it's still normal for you to be able to do other things, go to work, but again, depending on the loss, the different types of losses will have a different impact on you. But I think we can really get into that more as a topic on its own, because I think it is a really important topic, and one that is relevant because of the different losses that we've experienced. And also you said something really important about how people end up getting addicted and struggling with all kinds of addictions, and a part of it is because some of them are trying to self-medicate, so somebody is not sleeping, and when you're not sleeping, some will drink alcohol, and when you drink, then you can sleep, but don't realize the impact that alcohol will have on your brain, and how it then in the long run makes things worse than better. But even when you realize that I'm now worse off from this alcohol, you are unable to come out of that and take yourself out of the situation where you are dependent on alcohol. And so sometimes it does then take intervention out of what you can do for yourself to treat the depression, for instance, so that when you're not depressed, you're more able to say no to the alcohol. But when you're depressed, and they're just told stop drinking alcohol and there's nothing else, you're like, then what's the point? I'd rather
What's
at
the
least if I
point?
can keep exactly. So a lot of people will say, if I can at least be drunk and forget right now, it's
Yeah.
better than just always being miserable the whole of my life. I will take the few hours that alcohol offers. And yet people don't realize that when you get treatment, there's actually better. You can get to a point where you are better all the time and you don't have to be, in that space where you're in. So a lot of people are also very afraid of treatment. They're afraid of medication like antidepressants and antipsychotics or whatever it is, because they're like, no, it causes addiction, or it will do this to your body, or I have this relative who became a zombie because of this, different things like that. But again, that is coming from a place of ignorance. So I like to give this example of a cough. Somebody may cough because they have a flu, which will go away on its own whether you treat it or not. So someone may have symptoms of mental illness, which may go away whether you treat them or not. Someone else's cough may be due to pneumonia. And if you treat pneumonia, after 1 week, you're fine. If you don't treat it, it can actually kill you. So there are certain mental illnesses where if you just treat, you get better, and that's done. You finish your course, you never need treatment again. But if you have TB, for instance, the treatment of, it's still a cough. The treatment for TB takes 6 months. It's different from pneumonia, which is 1 week, And so somebody else needs to be on their medication for at least 6 months or a year or whatever it is because of the kind of cough they had. Then you have somebody else who's coughing because they have lung cancer. And their lung cancer has progressed that they will die anyway, whether or not they receive treatment, right? But they did receive treatment. What killed them may not be the treatment, but the cancer that they had. So you'll find that somebody else will say, no, I have this relative who went on medication and then they got sick and they never recovered again. But it could be because their condition, entailed that.
You just reminded me of this COVID thing where they're like, if the person dies, it's underlying issues. So you
exactly.
explain that it makes sense.
Exactly. Wow. So we need to realize that symptoms of themselves may not mean much. You need to be actually go and find out what is causing your issue and then make an informed decision about what treatment to get. So a lot of the times we make decisions based on ignorance or what this aunt said or this relative did and all that stuff. So a lot of people come and then don't get the treatment that they need and end up then, addicted to all sorts of things because you feel like that is better for you. You'd rather do that. But when you weigh the pros and the cons, a lot of the time, treatment, the benefits of treatment outweigh whatever side effects or risks that come with treatment. Yeah.
Thank you so much, because a lot of marriages are struggling right now with that pornography thing where people are probably, like you said, numbing their pain by taking the wrong habit, like, and before you know it, you become so addicted, you can't even stop. And I think you've helped to clarify that. Most women will be like, Anna, I've tried to dress up, I've tried to look good. It's not making a difference, but it's actually the person who needs to make that decision to get the help that they need. Thank you so much, Mercy. And yeah, there's a lot to share because we need to talk about the grieving one. So whenever you're free, please do come back and we talk about it. Do you have any final words when it comes to mental health issues that you'd want to share before we close?
Okay, thank you so much, Anna, for having me. This was really great. And yeah, I think it's just also made me realize that there is so much that we can share and, concerning mental health issues. But part of it, I think, is to be able to stop and think and realize that an illness is something sometimes that you may not have control over, as much as if you're diabetic, as much as you may desire to produce insulin, you will not produce it on your own because you're diabetic. You need to do different things. You need to work on your lifestyle, exercise, diet. But if your body doesn't have insulin, you need to take in that insulin injection, And so it's the same with mental illness, that yes, the outside may look like things that we have control over, but sometimes we may not, and we may need something that will help us adjust, things that have gone wrong in terms of the chemical balances in the brain, our way of thinking, our way of viewing things, and all that stuff. And also, I just want to say, because I think the audience is mostly Christian, right? That mental illness really isn't a sign of lack of faith, just like suffering from any other illness. Paul himself, who we look up to in terms of having faith and, worked for God, had an issue where God allowed him to have a physical issue with his sight, and God allowed that despite his strong faith. So whether it's physical illness or mental illness, seeking help doesn't mean, that we are lacking in faith, but rather it helps us. A lot of the times you'll find that people who are depressed or anxious will struggle in their spiritual lives. And it can strain, like you said, that mental illness strains relationships, and it can also strain your relationship with God. So getting treatment is actually helping you so that you are more able to receive God's word and have a good relationship with him as well, because it's that relationship which is saving. And so mental illness, has a way of isolating you from loved ones and loved ones, including God himself and everybody else. So it also takes you realizing that, this is messing me up. I need to get help, so that you are not isolated from the support systems that will actually help you get better and get out of, the struggles. Yeah.
Hey, you're truly a wise woman. Hey. Thank you so much, Mercy. I can't wait for you to come back so we continue this conversation, because these are real issues affecting people every day. And what can we actually do? Because people are struggling out there. Like you said, the COVID numbers are going up. So it's also being intentional about what we do and getting the help that we need. So thank you so much. And I can't wait to have you back. And to everyone, thank you for watching. If you would want more information and to get in touch with her, please feel free to let me know and I can link you up with her. Thank you so much, and
Thanks,
bye.
Anna. Thank you.